Care Services, because there's no place like home.
Good morning. Happy South Florida Saturday. Is it really? Wow, it's the last day of August, isn't it? I know, it's amazing.
Goodness. Can you believe it?
Time's flying by, and that voice you hear, Andrea Albertini, my dear friend for a lot of years, and my co-host here on Limitless Health Horizons, brought to you by Horizon Care Services. Excellence in private duty home care, the very best that there is. When it comes to the care, when it comes to all the options, when it comes to the outcomes, Horizon is the way to go. And you can learn more about all of it by checking out their website, which is horizoncareservices.com. Nice and simple, horizoncareservices.com. You can also call 561-776-7757, 561-776-7757. They're a company that will actually answer the phone the vast majority of the time or get right back to you in minutes if everyone's busy. So I love it. The service is there in every aspect, from the original call right through all of the care. Good morning, Andrea.
Good morning. Happy Saturday to you and to everyone that joined us one more time.
It's so great to talk with you, Andrea. And we've talked a lot about Horizon and what home care is and what you do that sets you apart. Now today we've got a couple specific things we want to discuss that you mentioned to me before we went on the air. But before we get there, just for anyone who may just be tuning in for the first time or maybe not be familiar with what home care is all about, what does Horizon do, Andrea? And I know that's a really wide umbrella because there's not much you don't do. But home care, what is it? What's it all about?
Well, home care in Horizon Care Services are a little different in a way.
Okay.
Because home health agencies, you have your Medicare agency that comes in, do a visit, physical therapy, nursing, PT, and leave, right? And then you have Horizon Care Services, private duty home care, who does hourly and living care, from registered nurses to CNAs, live-in caregiver, hourly care, bathing, dressing, cooking, cleaning, managing your medication, managing your doctor's appointment, and many more. And what makes Horizon different is the care that we provide, the dedication that we provide to every single client that we have.
Yes. It's so true. And I mean, that shows not only in your results and some of the reviews, some of the people we've spoken to whose family has used your care, but also the people that work for Horizon, the caregivers that have been there, 60% of them since day one, since you first started this company. It says so much for the quality of the care, the atmosphere that is provided, and just the heart that kind of comes with the entire thing. Andrea gave a little short list of some of the things that Horizon does.
Yes,
and,
I did.
I mean, it's way more than that. Your umbrella is just massive.
It's very, very, it's so broad. I mean, we are not just a private duty agency, Mike, you know that. We are a lot more than that.
You really are. And I mean, learn more about it. You can head to horizoncareservices.com, and there's other areas of it. Elder Care Finders, Horizon Mobile Physician, and we're going to talk about one of those today in just a little bit. But before we get there, one of the things that we were chatting about before we went on the air was transitional care and kind of follow-up and so on. And those are terms that not everybody is as familiar with, but it's a really important aspect of quality home care. So let's talk a little bit about it. What does that mean? I know you had a patient recently that we were discussing.
Oh, yeah. So there's different ways of transitional care. So Horizon Care Services, the private duty side. So Horizon Care Service is an umbrella, right? It's an umbrella. So we have the mobile physician practice, we have the senior placement company, and then we have the private duty agency. So we have this incredible transitional care program that basically, if you are moving in your mom or your dad into an assisted living facility, we help pack them, we help bring their medication, and we stay with them for a few days to get them acclimated to the new facility.
And that's a big thing because that's a big change. I mean, that's a huge change.
Absolutely. So we have that. But the other one, it falls into transitional care from hospital to home and from nursing, from inpatient skilled nursing to home, right?
Okay.
So what happens a lot of times is, the insurance companies pretty much control how much money they're going to pay the hospital to keep a patient in, right? So people get discharged too fast.
The hospital wants them out of there because it costs them less, and then, it increases their bottom line if they almost work like a mill in and out.
Exactly.
Yeah.
So the longer they keep the patient, the less money they make, right? But they also, if the patient goes home and come back within, I think it's like within the first 10 days or the first 30 days, if they get readmitted, actually the insurance company and Medicare takes their money away from them. So you have to do the appropriate discharges. However, people are still not educated on how to do that. So we had a client that was a motorcycle accident, last week, and he hurt both of his arms. Of course, he had scabs and everything all over the place.
Road rash.
Called a road rash.
Yeah.
So one arm he already had the surgery on, and one arm to fix the elbow, and the other one, so both arms are all covered, right?
And that certainly takes away from one's ability to be independent at all. If you have both of your arms bandaged up, one of them damaged enough, you need surgery on the elbow. I mean, this is somebody who needed help.
Right. So we have a program where our nurses, or me, I'm a PT,
Yep.
our nurses or me go into the hospital, pick up this patient, look at the discharge order, make sure they have their medication, go get the medication, drop the patient home, make sure they have food, make sure the home is clean, make sure that home is suitable enough for that client to come home. Okay. On top of all, actually I was the one who actually was picking up this patient.
Gotcha. Okay.
Okay.
Which
I got a lot to talk about.
More hands-on than anybody gets. I know. I could tell that this is one that you were speaking very. This was my story type deal here. Yeah.
And I was walking here at the studio like a fireball.
You really were after what you ran into with this.
Yeah. So I'm looking at this discharge order now. The patient was in trauma. So the trauma people. So you're telling me that the trauma people discharged him with this instruction, which keeps the wound wet to dry, and don't soak it. And call the doctor, call the surgeon within 7 to 10 days to follow up. Wait a minute. Is that your discharge planning that you did?
That's not a whole lot of information there.
There's not a lot of information. Of course, that the family hire us privately.
Right.
The hospital did not refer. The hospital didn't know discharge planning whatsoever.
Well, no, they put it on that patient who already couldn't use his arms because of the injury. Here you go. Keep it dry. Call your doctor. And now it's not our problem.
Now, but it is, because if that patient goes back in there with infection or anything else, it's the liability of the hospital.
Right back on. Opens up to lawsuits and everything, as well as all. I mean, this is danger to the arms, infection there with a bare bones instruction that doesn't tell me anything.
Nothing. So me and my team, you have met most of my team already.
Yeah. Love them.
And so I'm like, okay, I don't understand this. So I went to talk to the case manager, and she goes, oh, he's fine to go home. I said, but you have no instruction here. Well, you need to call the trauma team. So I come back. So I took care of the patient. I got the medicine for the patient. I dropped the patient at home. I had a caregiver there, meeting me at the patient's home because he can't use his arms. Okay. So now I go back to my office to drop off paperwork and whatever. Sure. So I asked one of my doctors, and I said, can you help me read this, because I'm not a clinician? And she's like, what is this about? I said, I have no idea. So I explained to her what happened and everything. Right. She had to call the surgeon to find out, okay, what are we doing with this guy? What are we doing? And the PA, the physician assistant of this particular surgeon, instead of looking at the patient's file before she answered, couldn't even answer to my own doctor on the phone.
Okay, wait.
So I had to send my doctor over to the client's house, and log into the portal of this patient at the hospital to find out exactly what we need to do for this patient.
Okay, this is just like a really complicated web of lack of information, and then this person, well, you had to do this. Well, wait, I thought it just said calling the trauma team. Where was that on here? How would I have known to do that? And then you've got to find out from the surgeon, but that's not on here either. It basically just said keep it dry and call your doctor.
call your doctor in 7 to 10 days to follow up.
Everything is missing from that.
Yeah, exactly.
There's nothing helpful in that.
No, it's just this huge gap. So this patient is home with 2 arms wrapped, who not knowing what to do next.
This is
Okay?
That's a nightmare.
It's a nightmare. But wait, get this. When my doctor got into the portal,
Right.
because he had just been discharged, she couldn't read any of it.
So
now, thank God, I said, you need to go to the patient's house right now.
right.
And we need to find out from the patient some of the things that what have they done
Right.
before that patient left the
We
hospital.
need the information on
We
this.
need the
And the patient
information.
needs the information on this.
Right.
Yeah.
So thank God she went in and she got everything that needed that they did. So they did change the wound yesterday before he left.
Okay, that's good.
So there's a lot of things that they did that was not written up. But what is the follow up now?
Yeah, what do you do from here? And there's certainly no clear direction,
No.
not even a direction pointing you in a direction.
No, but she said to me, look, they usually keep a bandage. They don't have to change the wound all the time under the circumstance. She knew what to do.
Right.
But, she needed to be able to get the data for what has been done before he left the hospital and what she needs to do, from that point on.
Sure. I mean, that's a continuity of care thing.
Yeah.
It really is amazing how just tossed into sink or swim. And
pretty
it's
much.
awfully hard to swim when you have
Pretty
2
much.
arms you can't use.
But granted, this person is 34 years old. Can you imagine if it was somebody like 60, 65 on a motorcycle, 70? I mean, that's perfectly healthy.
Sure,
But-
but we see it here. I mean, look at the streets here in Palm Beach County. I see people of all ages on motorcycles a lot.
Yeah.
I mean, we have a very active senior community
We
here.
do.
And some of them do love to cruise, baby.
Oh, yeah, they do. Believe me, I know.
I know. It really is.
Sometimes I see some, you shouldn't be doing that. Can you just drive your Porsche convertible?
Please, I hear it all the time about me. What are you doing climbing on that couch and leaping off when you're singing, right? But it's like, it's one of those things where their quality of life is that, right? That's something they enjoy doing.
Yeah.
It may represent something that's a great time in their life. It may have been something that they retired and they said, I want to go cross country on my motorcycle. These are things that people plan and they do.
Yes.
And there is some risk involved in them. But, if that happens, then you need to know what to do next. And that transition, I think people often think, well, the hard part is transition from home to hospital, right? Then you're back home after that. Everything's fine. You're back home. You're good to go. You're in your space. But if you don't know what to do with that, your arms are bandaged. There's this medication. There's this medication. What can I do? Is this one going to make me a fall risk? Can I get dizzy from this one? Will this interact with this one? Where do we go from there?
Right.
That transition home is just as important. In fact, probably more important because for most of us, there's no medical supervision when we get home unless we've got Horizon Care Services there.
Exactly.
Yeah.
Exactly.
That's where you come in.
Exactly. But if you don't have me, if you don't have a company like mine, which there's no such a thing out there,
Just you.
just me, I don't know what these people would do. It's crazy.
It really is.
It's sad, Mike. It's really sad.
Well, it is very, very sad because, again, everything is, outside of what you're doing. For them, the outcome is we sent them home.
And you know what the nurse said to me at the hospital?
What?
Thank God he has you and you in healthcare industry. Because I was like, okay, give me the orders, give me the prescription. Okay, where's this? Where's that?
Right.
And she's looking at me, and I had my uniform on. This is Horizon Care
Sure.
Services. And she said, thank God that they know me and I'm in healthcare, and thank God the family have hired you.
That's exactly what it is. Because, again, you think to yourself, well, keep it dry. We're good to go. It's so much more than that. That transition,
is.
that transition is a really important point when it comes to fighting infection, when it comes to making sure that the needs are met, when it makes making sure that if they're on a short-term medication, that it's not going to interact with another medication. And with Horizon, they're going to know the other medications that they're on. They're going to know what their history is already. They're going to know, well, this medication they sent you home with, it's going to interact with this one. You're going to know that.
Exactly.
I wouldn't, as someone who doesn't have that knowledge.
Exactly.
I'm coming home with a doctor told me to take this and keep them dry, and I'm good to go. Oh, there is far more to it than that.
There is, because when the doctor got there, he had 3 narcotics.
Right. Wait, I'm sorry.
So she goes, oh, wait a minute. Okay, this cannot interact with this. This cannot interact with this. No, he can't take that. So.
And messing with
It's
narcotics.
just, it was weird. The whole thing was just weird.
One hand that doesn't always know what the other one's
So-
doing when you get to healthcare.
Yeah.
So many different people involved, and Horizon kind of ties it all together.
Yes.
It makes the one basket that everything is included in.
Exactly.
And that's what you need to find out about. HorizonCareServices.com. HorizonCareServices.com. 561-776-7757. 561-776-7757. And then, so, let's say you've got Horizon, you've been able to work through that transition. You've got the medication straight. You know what to do when it comes to that wound itself. And now you've got the right people there to care for you and make sure it's covered. But even after that, the follow-up on it, this person is now in their home, which is a great situation. You want to be home.
Of course.
But you're not surrounded by medical professionals unless you have like Horizon Care Services with you. So from there, that follow-up, the next few steps, those are also key when it comes to proper recovery.
Oh, absolutely. Absolutely. Then we have the nurse navigating program that you love.
I do love it.
I know you do love it.
I do.
That if a person is in a hospital and they don't have an advocate,
Right.
it falls into our care management in our nurse navigator program, that person can actually help you navigate through, so this is what we also did
Right.
for this patient. We were there every single day, making sure we're meeting with the surgeon, make sure we met with the admitting doctor, with the trauma team. What's going on? What's the plan?
Yes.
Everything.
Continuity of information.
Exactly.
It's all there.
Very
And that's
important.
what you need. So,
Yeah.
and then even after that, the transition has happened. We've got a good outcome from that because Horizon was there to supervise that care to make sure that everything was laid out properly, proper instructions were given. But even after that, things can happen. They can come down the pike.
Oh, absolutely. Nothing's perfect.
Nothing's perfect.
know.
So after that, somebody's home, but they may still be on some longer term medications that might make them dizzy. There are things that can happen that can be risky for that person then. And then, well, that's where Mobile Physician comes in. And you know how much I love this program.
I love it too because I fell last week
Okay.
and in my own house.
Right.
And actually, one of my doctors just happened to stop in to drop something off.
Oh, well, I'm glad they were there.
And she immediately ordered some mobile X-ray. I had an X-ray company that came into my house and X-rayed my hips
Okay.
because I fell right on my
Ow,
kitchen.
yes.
I know. I'm
that's
still
rough.
hurting, but
I bet. And again, you're a healthy woman. You're younger.
oh yeah,
If that had been someone who was older than that, or someone who had osteoporosis, or someone who had other issues, or a recent replacement, a hip replacement or something,
oh god, I can't
then
even.
that would have been a devastating.
Oh yeah,
effect.
for sure. Oh for sure.
I'm 51. I don't want to fall, man. It would hurt.
Oh,
And-
I'm still hurting.
And we're in pretty good shape.
Yeah.
If you had someone who had fallen and it was worse than that, thankfully that mobile physician program means that somebody can get out there and help out quickly.
Oh, absolutely, for sure. And remember, we are right now doing from Boca to Stewart. That's
Right.
where we're servicing right now. We're hiring some new clinicians for Broward County and Martin County. So we're growing very fast, and I'm really excited because we're doing such a tremendous amount of wonderful work out there.
We had a great guest in who is one of those mobile physicians.
Yes,
and
yes.
she was great.
She's awesome.
Her attitude was great.
Yeah. She loves her patients.
You can really tell. Her knowledge is
Yeah.
there. Her heart is in it. And she goes right out.
Oh, she does.
She goes to the home.
She does. She's awesome.
You know,
She's just awesome.
And if you have someone who has been through that transition, but they're still, nobody's ever really out of the woods for quite a while.
Yeah.
This person, through Horizon, can come in right to the home, which is something that's been unheard of for decades.
Yes.
You're bringing it back.
Yes.
Why?
Labs, everything, because you have a big problem, right, in this country. But not enough people is going to medical school.
Right.
Okay, most internal medicine physicians cannot accept any more patients, and patients, you'll be surprised at how many people don't have a primary care.
Would I? I mean, are people really putting it off? I guess so. I mean, it's that complicated, right?
Yep. So many people who don't have primary care.
This one's not on my plan. After a while, you just give up looking because it's so frustrating.
Yeah, and one of the great thing about our mobile physician practice,
I look at that
I'm so
smile.
excited.
Oh, she's excited. I love seeing that face.
Is that we have three actually incredible groups of neurologists. Two in Boca, one in West Palm, and actually the one in West Palm, I want to have him here. And talk about the research program that he's doing on Alzheimer's.
Oh wow.
And some of the people that's on trial for 6 years, and he's doing fantastic. And I want to have him here. I don't want to say his name yet because I want to bring him over and he want to talk about it hopefully when I come back next week.
That's extremely important work.
Very important. Here. And then the other one, Dr. Spinoza, I can talk to you about Dr. Spinoza in Boca. And he's amazing. He does sciatic and he does so much other things. And some of, the one thing that makes us so special is that we have so many connections with the best cardiologists, the best orthopedics, and the best neurologists that we can refer. So if you're calling a doctor and say, oh, Andrea, it's going to take me 3 weeks to get an appointment, we can get you an appointment sometimes with the same day.
The same day?
Yeah. So that's the kind of connection that we have with the relationships that we have with some of those doctors. So it's just really, I'm so happy with that division. I mean, I love Horizon Care Service, my private duty.
That's your main focus. You founded it.
Yeah, it's just my baby. And we were talking about it today because a lot of our patients are very lonely. And they call the office and they always speak with all the employees. They go around speaking with everybody on the phone. It's the cutest thing ever.
But what a feather in your cap that is.
Yeah.
How many people want to call the people that are providing for their health just to say hi? How many are calling because they feel that kind of a personal relationship?
6 o'clock in the morning, 6:30 in the morning.
You're going to get that with Horizon. That's the kind of relationships you build. And those are the kind of relationships that can happen with mobile physicians as well.
Oh, absolutely.
When they've come into your home and they see what the lifestyle is like. They see what the likes and dislikes are.
Yeah.
That doctor, that physician is going to get to know that person who needs the care as a person who needs the care, not a name on a chart, not someone who just happens to be in room 41, bed B.
Exactly.
They get to know this human being on their turf. When people are, and honestly, when people are at their homes and they feel comfortable on their turf, they don't feel like they're intimidated. They don't feel like they are, in the doctor's office. They're at their place with someone who's there to help them out. They are often more honest with things, more open with things, more vulnerable in their way, which is really important when it comes to this.
Yeah, like this gentleman that I took home yesterday.
Right.
He was crying. He was so upset. He was crying. I don't know what I'm going to do. Both of my arms are, wrapped. And I said, you need to relax. I already set everything up for you. You're fine. And and the caregiver was already there waiting for him when he got home. And he just literally lay in bed and collapsed because he hasn't been able to sleep since Friday because, you're in a hospital. Who sleeps in a hospital?
No, it's a good point.
Yeah.
And I've got to tell you, what a thing that is to get home and even after that kind of an issue, to be able to relax enough to sleep. Yeah. He had to have known he was in great hands.
Yeah, I was there 3 hours later and he was passed out.
Really?
Yeah.
And again, I'm such a strong believer in lack of stress being way better for outcomes in recovery.
Oh, for
right?
sure. For
being
sure.
at home is a big part of that.
Yes.
But being at home and certain that you know what to do, or there are people who are there who can help you know what to do and do the right thing, that is going to make it that much better. You're going to sleep easy, knowing that the right people are there at your home.
Exactly.
Knowing that doctor, that physician can literally come out to your home.
Yes.
Knowing that you're on your turf in a place that you are comfortable, in your bedroom, the way that you laid it out. You know where your remote is. Even if you can't carry it because your arms are bandaged, you can tell the person, hey, third drawer on the top. Can you turn my TV on and watch this with me?
Yeah.
It's a huge difference.
It really is, and you're not alone.
And isn't that huge? Isolation is enough of an issue.
It is. I mean, he's not alone. He doesn't feel helpless.
He doesn't feel helpless. That was the word that came to mind. He's got an advocate right there with him.
Exactly. She went and got food for him. I dropped off his medication. He was fine. But he's in pain, of course. He's going to be in pain for a little while.
And that's going to happen. That's part of it. But, when you take away the loneliness, when you take the fear away of, not knowing what the next step is, well, mobile physicians are there to help lay it out, to help take care of that after the transition people have been there to put that plan in place.
Yes.
Everything is covered on this. And that even begins with that initial call, because the nurse navigator can be there at the hospital in the first place, even before the patient arrives, to make sure things are laid out. They're there as an advocate during that whole time. Then you've got somebody there for transition and follow-up. And Horizon Care Services has all of that covered, either with their core umbrella or with the right connections that they have.
Yeah.
There's no boxes unchecked here.
No. It's very exciting.
It really is. And I mean, especially when you get somebody who is older. We're talking about somebody in this case who's younger, who had a motorcycle accident. You get somebody older who has more fears, who may be more susceptible to infection or more of a fall risk, or, may not have that spouse who is there to help out or tell them what's going on. You've got the rest of that team there for that care. Horizon Mobile Physician has their own website and phone number, by the way. And you can learn more by calling them or checking it out. Their number is 561-817-8274, 561-817-8274. And the website, very, very simple to remember, horizonmobilephysician.com. It's so cutting edge, which is kind of funny to say, because this used to be standard practice back when medical care was about the care and about the patient and about the people involved before it became bottom line and stockholder, right?
Yep.
This is a return to those days. It's a return to medical care with the focus on the care, focus on the human beings involved with it. HorizonMobilePhysician.com. And then everything else, that transitional care, the home care aspect of it that Horizon brings to the table and does better than anyone and has been for the past 20 years.
Yes, 21. This year, 21.
21 years.
Mm-hmm.
If Horizon was a human being, they could legally drink.
Only you.
Only I could say that, right? But, it strikes me that. I mean, that's amazing. That's somebody been through high school and the first 4 years of college at this point.
Yeah.
Horizon is a seasoned company with seasoned employees and seasoned, polished caregivers, 60% of whom have been there from day one, just like Andrea, the owner of it, who started it with heart, has passed that on. It's always been about the care for Andrea. It is. It remains that way. That's why the transitional care is there. That's why the nurse navigators, that's why the physicians, that's why they're all the best in their field. And you can learn more about all of it. Head over to horizoncareservices.com, horizoncareservices.com, or call 561-776-7757. Andrea still in the trenches with this. She's still one of the people that works with the patients who need the care every single day. She passes that wisdom on, passes that leadership on to everyone else involved. 561-776-7757, horizoncareservices.com. Excellence in private duty home care and so far beyond. The menu keeps getting bigger. And Andrea, we keep speeding through the shows. It's amazing because we're out of time.
Yeah, and I had so much more to talk about it.
I know. We're going to get to that. We'll have to get to that next week.
I guess so.
But Horizon Care Services, Limitless Health Horizons. That's why the show is called that, because the menu of options, that umbrella keeps on getting wider and wider, and there are no limits in sight.
Nope. And I love to come here and be able to share my experience with everyone.
It's a beautiful thing to get to hear it from you. You're in the trenches. You've got the best care. You're Andrea Albertini. What more is there to say?
Oh, thank you, Mike.
You know it. HorizonCareServices.com, 561-776-7757. Call and learn more about it. This has been Limitless Health Horizons on Legends 100.3. Happy South Florida Saturday.
Happy South Florida Saturday for everyone.
Stick around.
Horizon Care Services, because there's no place like home.